retiree health benefits. This slide's just an overview. We're going to talk about eligibility requirements. We're going to talk about what happens if you are still eligible for the active plan of benefits when you retire. We'll, of course, look at premiums. We'll talk about the situations in which you can postpone enrollment. We'll talk about coverage both before and after Medicare. We'll talk about some additional benefits that are available to you. And we'll talk about the Carpenter Center for Health and Vision. And we'll wrap it up with prescription drug benefits. Okay. So the first question is whether or not you are eligible for retiree health benefits. If you are eligible, the retiree health benefit forms will be provided to you by the Retirement Benefits Department at the same time you complete your pension application. Now, for those of you that are going to use today's handouts to actually apply for pension, the health benefit forms that are in the health benefits handout have the word sample printed across them. So you cannot actually use those health benefit forms. So once your pension application comes into the pension fund office, we will send out health benefit forms to you for completion. Or if once we go over the requirements, you think that you qualify for retiree health benefits, you can certainly give the Retirement Benefits Department a call and we can email you or mail you if you prefer paper mail through the post office. We can mail you out in a set of actual forms that don't say sample across them that you can use for enrolling in the retiree health benefits. Okay. So in order to be eligible, in general, you need to have 10 years of eligibility service to be eligible for retiree benefits. And I'm going to bring up a couple of things here. So for most individuals, eligibility service is equivalent to vesting credit, provided that the employers that you worked for paid in to both the pension program and the health and welfare program. Eligibility service ends up being the same as vesting credit. So you can look at your A personalized printout with the A, the big A on the top right corner, and at the bottom of that, the totals show you how many years of vesting credit that you have. Okay, provided that your employers paid both pension and health and welfare, and you would know that because you should know whether or not you've had the carpenter's health benefits for however many years you've been a carpenter. You can use that vesting credit total for this presentation to look for eligibility and for the tiered premiums. Okay. So 10 years of eligibility service if you have never had a 3-year calculation break in service. If at some time you had a calculation break in service, so you had 3 or more consecutive calendar years without any pension credit, then the requirement is 15 years of eligibility service. 15 years of, most of you again can look at the vesting service total on your individual A credit printout that was in with your personalized packet of information. Okay. So what happens when you retire, whether and you still have active health benefits at the time of your retirement? So if you are not eligible, let's do it backwards. If you're not eligible for the active plan health benefits at the time your pension starts, and if you are eligible for and you enroll in the retiree health benefits, which the rest of this webinar is going to talk about the retiree health benefits, then your retiree health benefits will begin on your pension award date. So think back before the break, we were talking about now is the time to file for July and how sometimes your award date is different from your effective date. Health benefits never go retroactive. Okay. If you apply at the end of June and you want your pension to start in July, we talked about maybe you'd be entitled to retroactive July pension money, but your retiree health benefits never go retroactive. So retiree health benefits start on your award date if you are not eligible for the active plan of benefits. Okay? So that's just another reason why if you need the retiree health benefits, you want to make sure that you're applying in advance, and our recommendation is 4 months in advance. If you are eligible for the active plan health coverage, then the coverage in the active plan will end when you fall below a total of 1,000 hours for the past 4 work quarters. Okay, and we're going to look at that on the next slide. But even though your pension starts, if you have enough hours, your active eligibility will still continue. So in many cases, when an individual's pension starts, even though they're considered a pensioner for the pension money, they still continue on the active plan of health benefits, usually for about 6 months after retirement, depending on how many hours the individual has worked. Okay. So if you are eligible for the active plan at the time your pension starts, that active coverage will maintain and will stay in place until you fall below 1,000 hours for the past 4 quarters. At that point, you have 2 options. Your first option would be that you move directly from the active benefits directly onto the retiree plan of benefits. Okay? You will still complete your enrollment forms at the time you complete your pension application, because the Retirement Benefits Department will code the computer system to indicate yes or no whether or not you want the retiree health benefits right after the active plan of benefits end, right after your hours run out and you fall below 1,000 hours for the past 4 quarters. Okay. This is what most people do, but depending on your individual situation, you may want to consider picking up continuation coverage under COBRA after the active benefits end before you move on to the retiree benefits. Now, sometimes people hear COBRA and they think, COBRA, what's COBRA? It's this mysterious word that nobody seems to really understand. So there is absolutely nothing mysterious about continuation coverage under COBRA. COBRA is simply an acronym, and it stands for the Consolidated Omnibus Budget Reconciliation Act, and that was passed back in 1985. So it's just a law. So what the COBRA law says is that when your active benefits are ending because you fall below 1,000 hours for the past 4 quarters, you have the opportunity to continue on the active benefits by paying for the active benefits. You pay a premium out of your pocket for the active benefits. And you can continue those active benefits. You can pay a premium for those same active benefits with COBRA, and you can do that for a maximum of 18 months. Once that 18-month period is over with, then you would still move on to the retiree benefits. So the question is whether you want to move directly from the active benefits onto the retiree benefits, or after the active benefits, if you want to pick up continuation coverage under the COBRA law for 18 months maximum, and then after that continuation coverage under COBRA, subsequently move on to the retiree benefits. So you make a choice between the two. Well, why would someone want to continue coverage under COBRA? The COBRA premiums are in the handout packet, the health benefit handout packet, and they're on page H4 of the health benefit handout. If you don't have that handy, I will tell you that COBRA, continuation coverage for the active benefits, costs $681 per person per month, $681 per person per month, if you are going to continue the full package of the active benefits, including dental and vision, medical, dental, and vision. COBRA continuation coverage without dental and vision costs $616 per person per month. Okay, and we're going to look at the retiree premiums on the next slide. So you want to compare your options. Somebody who's got a lot of years of eligibility service of vesting credit in, your retiree premiums are going to be relatively low. But someone who doesn't have so many years in, your retiree premiums will be more. Also, COBRA may make sense for you if you're falling out of active eligibility, say toward the end of the year. Maybe you've already met your out-of-pocket deductible and your out-of-pocket maximum. Maybe the active plan is currently paying your claims at 100% for the balance of the calendar year because you've met your out-of-pocket max. Maybe it makes sense for you to do continuation on coverage under COBRA. Also, please note that continuation coverage under COBRA, it's 18 months maximum. If you want to move to COBRA before the retiree plan, you do not have to take the full 18 months. You could do COBRA for 2 months or for 4 months or for 6 months. Okay, so you can do COBRA for a lesser number of months before moving on to the retiree plan. If indeed you are someone who vested and who maybe is not currently working under the Mid-America Carpenters Pension Fund, under the Chicago Pension Fund, or you're not eligible for health benefits under the fund at this time, yes, you can pick up retiree coverage when your pension starts, provided that you meet the credit requirements that we discussed on a prior slide. So if you've been gone for a while, you will probably need 15 years of eligibility credit, of vesting credit, in order to be eligible for the retiree benefits. But you could come onto the retiree benefits when your pension starts, even if you are not eligible for the active benefits at the time your pension starts.